our panel members to the stage and for us to kick off another one of these aging life care roundtable discussions. And it looks like we got them all here. This is exciting. Well, uh, folks, before we dive into this discussion, let's get to know our panel members a little bit better. And Catherine, you're in. I'm looking at my Brady Bunch layout here. Catherine, I'm going to start with you. Tell us a little bit about your background and where your practice is located.
Sure. Yeah. Thanks, Steve, for having us. Good to be here with y'all. I come to you from the great state of Texas, and we're in Central Texas in Austin. We have services in Austin and San Antonio. I serve as the CEO of CareFor, and we provide care management, home care, hospice, and guardianship to Central Texas. I'm a registered nurse. I spent the first 7 years of my career in pediatric oncology and then had the opportunity to join a founder-led care management firm 12 years ago, and have had the pleasure of being here just a little over a decade.
Wow. It's interesting. I'm fascinated by the backgrounds of the aging life care managers I've met, and I have to say there's more than a few that started on the other side of the chapters of life as with pediatrics. So
Yeah,
this is
I think people get surprised, but then the more you think about it, when you're working with the pediatric population, you're working with a family system, certainly within chronic illness. And you've got parents and siblings and other loved ones. And when you move into the aging space, it's really the same. You're not really working with just the patient. There's usually a spouse and adult children and other folks within their community. So it's the other side, but it's certainly the same ecosystem. It's just flipped a little bit.
And it's also a great reminder that aging begins on the delivery room table, folks, not with an AARP card. We're all aging if we're alive. Um, Heidi, let's go to you next. Tell us a little bit about your background.
Hi, everybody. My name is Heidi Jarvis, and I am in Northern Virginia, right outside of DC. And the company that I co-founded about 13 years ago now is Caring Considerations. We strictly do care management. I started in senior living, so I've been working with older adults and their families since about 2006. And I just fell in love with the industry and supporting older adults. I think some of my background kind of pointed me in this direction because I did study sociology. I did want to be a social worker at one point. Teaching was kind of in my background too. And I think my co-panelists here will agree. We do a lot of education, right? And so I just became passionate about everything revolving around seniors.
I love it, Heidi. And Elyse, I'll go to you next. Tell us a little bit about your background and where you practice.
Okay, sure. Thank you, Steve. And also thank you for having us. So I'm Elyse Weber-Sacks. I am the president and owner of Connie Rosenberg and Associates Care Management, named after the founder, who was really one of the very early aging life care managers when it was really known as professional geriatric care management. So our practice has been around for 38 years. I took over 11 years ago. I'm a social worker by education. I licensed master's level social worker. I have worked in long-term care. I've worked in hospice. I also did a total career change thing early in my career and worked in the corporate world for a number of years, and then sort of came back to the population that I love and didn't really know about care management until I joined the practice and worked for the founder for a number of years and then took over, as I said, about 11 years ago. And we practice in Northern New Jersey, so the 10 counties that are outside of New York City, and we also do care management exclusively.
Wow. Okay. Well, I'm glad that you brought up you didn't know what aging life care manager was when you kind of came into this space. Elise, would you like to take a crack for those that may be in the audience or listening to this that have never heard of aging life care? tell us a little bit about what it is and the association as well.
Sure. I'd be happy to and proud to do that. So, aging life care is really a holistic umbrella term for people that for a profession that really helps guide families with the challenges that come up with aging and disability, primarily aging, but also disability. I think many of us also touch on that population and that cohort. I always say everyone takes the journey uniquely, but there are a lot of common themes that come up as people age: chronic illness, acute illness, dementia, of course, the intersection of finances with the aging process and how to plan ahead for long-term care. So we're sort of I sometimes use the analogy, we're sort of the general contractors. We're the sort of the big view people, and we are very tapped into resources locally. And we help guide families with all of those challenges. Sometimes it's on a consultation basis, and sometimes, many times, it's long-term ongoing relationships.
I love it. And what's great is I've been doing these for a while, and it started out with Susie Murphy calls aging life care wedding planners for growing older. Then we've had quarterbacks last month, sidekicks, and now general contractors. These are all great familiar analogies that we're all aware of that can help us better understand this profession. Now, before we dive into the discussion, I just want to let folks know, we've got 3 different geographic regions represented on the panel today. But just so you know, if you go to aginglifecare.org and you click on the orange button that says Find an Aging Life Care Expert, they've got a really easy to use search tool where, let's say here's a zip code for the Baltimore area, and I'm just clicking that, and boom, it brings up a bunch of aging life care professionals that are in that region. And it's so exciting to me because I remember the early days of the profession back in 1990 when I joined, where now there's literally an aging life care manager pretty much anywhere in the country that you're looking. Um, okay, so let's transition to the roundtable part of our discussion. And Catherine, I'll go back to you. Would you like to sort of share an insight or tips or case study? And then also, folks, just as a reminder, these are open discussions. So if you've got a question, whether it's related to what we're talking about on the stage today or not, feel free to drop it into chat or Q&A, and we'll address those. But Catherine, I'll let you go first.
Sure. Yeah. I mean, the question is quite broad, but what came to mind was just the um a theme that we see often when loved ones are calling. Um, our practice in particular works a lot in the contested space, but I think it holds true to anyone that is having a situation where their loved one is aging and you've got a new challenge and you're asking yourself, what is the right next step? And I think what we see a lot is there's potentially a lot of disagreement about what that next step is. And the 2 things that come to mind when I think about that is I think a lot of people um, don't, part of the disagreement stems from they don't really know what that loved one would choose. And I'm talking sort of like in an element of incapacity where maybe they can't verbalize as much their wishes anymore. And sort of this thought of, man, I wish I would have had some of these conversations earlier when they could still articulate that, because man, what a roadmap that would give us to help them age the way that they would have chosen for themselves. But then secondarily, when there's a lot of disagreement amongst maybe the spouse isn't the parent of the adult children, or everyone is very much related, they just have a disagreement about what should be next, it can very quickly become sort of towing my own personal agenda. As the daughter, this is what I think should happen. And so I'm going to muscle my way through to make that happen. And my sibling is going to toe a different line and head in that direction. And the spouse is going to go in a different direction. And the loved one in the middle, the mother, the wife, is torn. She's being pulled in 3 different directions. She wants to honor her husband. She wants to please her daughters. She doesn't want to choose one over the other. Or sometimes they do. And then you've got all this discord, and it really is what the care manager stepping in to manage is the family dynamics around that. And what we've lost is the center of the conversation, which is should be that loved one's decisions, desires, ways of living. I think we talk to a lot of children that want their parent to make maybe a different life choice than they've made. And that is really hard to reconcile with. And while honoring that, even though it's not something that you would want, but helping them live their life. And I think an aging life care professional can help hold space for that. I'm the first to say it's a lot easier for me to do it in my career than it is for my own personal family. Man, a lot of care managers joke about like, don't talk to me about my parents because I don't want anyone to know that an aging life care professional has parents that have like gone rogue or they're not listening to me. But I just think that's I want people to know first, you're not alone. This happens all the time. And also my recommendation suggestion would be just like take a deep breath because it's not your agenda versus your siblings or versus your parents. It's what does that individual want? What are what is their diagnosis or what are their medical needs? What are their social needs? What are their financial needs? And how do we integrate that and develop a plan that honors them, even if it's not something you would personally choose for yourself?
I love it. And I know it always comes up on this discussion is cost and payment and how to pay for aging life care managers. But I want to bring something up that kind of dovetails with what you just said, is that sometimes, let's say I'm an adult child and I call and contract with an aging life care manager to help me do something that I want for my mom or dad, and I'm writing the check. Uh, Correct me if I'm wrong, but that adult child is not the client, even if they're writing the check. It's mom or dad, correct?
Correct. And it's a challenge. And I mean, I would love to hear Elyse and Heidi's perspective on that because your patient is who you're advocating for. And because it's a private pay business, who that check comes from, candidly, is a relationship you need to manage and it matters. But I really think as the aging life care professional, it's our responsibility to build rapport, to build trust, and to be transparent up front. Like I hear you, and also I need you to listen for a moment. And that relationship can be tense at times. But I really do think it's important that the purpose of an aging life care manager is not to impose your agenda. It really is to bring in an expert that can honor their life, their wishes with a layer of expertise, knowledge, information on implementing resources to hopefully provide peace of mind to everyone. I say that's what we sell at CareFor. We sell peace of mind, and that's what we're after above all.
I love it. Yeah. Heidi and Elyse, would you like to jump in on this topic?
Well, I thought I would jump in with a comment that's really kind of very topical for me right now. In that I have a mother, and it was my mother, my stepfather. He recently passed away, but they're in Florida, and I'm in New Jersey. And because I understand the benefit of having an aging life care manager, and I've been struggling with some of these same issues myself. So as Catherine was saying, I mean, here I've been saying like I can't believe this happened to me. And I have had a care manager in place in South Florida for about a year and a half to help manage the care for my mom and until recently my stepfather. And another thing I just wanted to sort of piggyback on what Catherine said is that having an aging life care manager in place is also a buffer and allows the adult child to be the adult child, and not just be mired in the caregiving role that can often be very frustrating and for a whole myriad of reasons. And so only you can be the adult child, but someone else can, who's also an independent expert pair of eyes and ears. And I've had that experience myself as with my own mother now, where I wanted someone else to sort of say, am I right about this? And because I understand it, I'm open to that. So I think that's another real benefit that an aging life care manager can bring to the table, to bring to the situation.
I
And
love it. And thanks for sharing your personal story there, Elyse. I know you just literally got off a plane before
Mhm.
the discussion today.
Yeah, yeah.
Heidi, anything you'd care to add on this topic?
I'm glad you showed the website of Aging Life Care Association because we're all members of it. And I think it's important to have some sort of framework, a professional framework with the standards and ethics that the Aging Life Care Association provides. And the first two things on those standards and ethics are who's the client and respect self-determination, which means that unless they've been deemed incompetent by, a couple of doctors or whatever the process is, the older adult has the right to make decisions. And it might not always be, I think somebody said it, might not always be decisions we make for ourselves, but what we have to do is support those because it is their life and we respect that.
I love it. Thanks for throwing that in. And I dropped in the link to the site and the certification in professional conduct. A lot of times folks find that interesting. Now, Heidi, before today's discussion, you sent me over a few slides that I'm going to pull up here, but some real exciting news that the Aging Life Care Association has partnered with Virginia Tech on some study. Did you want to share some of the insights that we've learned from that?
Absolutely. I am so proud, not only because it was done in Virginia where I live, but the fact that our association went out and queried families. And we see the benefit of having an aging life care manager, right, Elise? But our clients have given us feedback, and we get what I call calls from the desperate daughter, or another loved one, of course, and the crisis hits and we're not always prepared. And I will also say that as aging life care professionals, we can do in 2 hours, but it might take you 2 weeks to figure out. So it's very valuable to ease the burden, to support everybody in the family, and of course, the older adult. And little by little, that trust builds, the care improves. I often say to families, just give it a month or two. You'll see it improve, and people just breathe a sigh of
Hmm.
relief. And
Wow,
and this research has shown exactly that.
great. And then let's see here. This is here's the next slide that you shared with me here.
And again, it's our association and how we all collaborate and work together, um, constant learning. And being a certified care manager requires, continuing education. And that's why we provide a high level of support. And 99% of the clients say they would recommend one to another
Yeah,
family.
no, and I've been at like informal barbecues or cocktail parties where somebody is talking about their experience with an aging life care manager, and inevitably somebody hears this and says, "Oh, I wish I had that for my mom," And then here's the last slide that you shared with me that outlines some more info.
Some really great statistics that just validates everything we do on a day-to-day basis. It's a lifestyle, it's a wonderful career, and it's showing a lot of value. And I don't think there's anybody I've come across in the last few years of doing this that didn't say to me, "Oh, this is going to be really needed going forward as our population ages."
This is great. Okay. Questions are coming in fast and furious, but what I'm going to do, folks, just keep them coming in. I want to circle back to Elyse. And Elyse, any sort of insights that you'd like to share? And then we'll just start banging out these questions. This is my favorite part, folks. I love when you all share your stories and your concerns. But Elyse, any insights that you're thinking about these days?
Well, I thought that, and I did just want to mention that Heidi said that the university was Virginia Tech in your state, but the survey was national. So I just want to
National.
make sure
Nationwide.
Good,
that it's
good point.
nationwide.
Yeah.
Um, so I guess I thought that it might be interesting to talk about a trend, and certainly the trend that I've seen a lot in our practice, and I know from conversations with colleagues, it's certainly not limited to northern New Jersey, is the influx of solo agers or solo seniors for into our practices, people who are really looking for something to a foundation, some connection, some support, who they may not have the more typical adult child or niece or nephew, or sometimes they do and they don't want that person to really be burdened with all of some of that those care needs, but primarily it's people without children for the most part, and they want to have some supports, and so they want to put something in place. So we are seeing that. Used to be an occasional call. We see it all. We get those calls all the time now. In my practice, we do offer to be healthcare power of attorney on a select basis, on a case by case basis. So we couple that for a lot of the solo agers. Not everyone does that, I know, and we don't do it as a blanket service either, as I said, but the need is out there. People know that, they may have 20, 30 years after retirement, and they're not sure what that future will bring, and they want to have some expert professional advice. So that's been an interesting part of the practice, I think, that's really grown.
Yeah, I think this is an amazing trend, and since I've been in this profession, it's been very difficult to get people to think about um, hiring an aging life care manager before they actually need it.
Mhm,
And
mhm.
now we're seeing where people are putting two and two together. It's sort of like I don't have a support network, and even if they have kids in a support network, they might not want to burden their kids who live all over the world with that. So I'm super excited about this and couldn't be more thrilled. And I know we'll probably take some more questions on this topic. Okay, so let's dive into these questions. And folks, I'll make sure I get to all of them. And I'm going back and forth with chat and Q&A. But Tina says, how does the agency life care manager help when dementia parent refuses to go to any doctor or get any help? Oh boy, we started off with an easy question, didn't we? Any words of wisdom for Tina?
I,
Go ahead, Heidi.
I'll, I'll just say, I feel you, and I think one of the best tools, if you can, in your area, is to have a house call doctor, because they've become more popular, and that helps a lot.
Really good point. And thanks to the pandemic, one positive thing that came out of that is that doctors actually make house calls now. So great suggestion there, Heidi. If we can't lead, I shouldn't I'm not going to use that analogy. If we can't get somebody to go to the doctor's office, let's bring the doctor's office to them.
Yeah.
I think
Any
to
other word?
Yeah, I was just gonna say, I think these are all it's always some version of a similar scenario, and everyone has their unique situation, but often I've seen an aging life care professional be helpful in those situations because I think Elyse was talking about, like you get to be the daughter, like it's not the child nagging them to do these things. I think a lot of times the generation, the aging generation right now that is needing help has a high respect for physicians in the medical community. And so if there is a professional saying, hey, we need to get some assistance here, sometimes they will be more apt to be a little bit more compliant, but at the same time, it can take time. And an aging life care professional certainly isn't a silver bullet to make everything possible. I do think it's relationship building, but I think the concierge doc, the house doc, bringing them into the home, And even if they're not, like, I don't want to take medicine or I'm not going to talk to them, if they can just have a social visit a few times and just build rapport and then slowly become agreeable to maybe a few different changes, I think those things can be helpful.
And also, Heidi, I'm glad you brought up the house doc and the concierge doc, but think about this. Somebody with dementia, any form of cognitive impairment, like going to the dentist, how overwhelming that can be. And now there are dental practices that are out there that are making home visits. So really kind of play around with that. But the great solution is, huddle with the aging life care manager, do a little brainstorming, and you might come up with some stuff. Okay, I knew this. Oh yeah.
If I could just add something real quickly to just, there's in graduate school and we call it like social work 101 is start where the client is. So, it's also not coming in like a bulldozer and, saying, I know what's right for you. I always like just to get to know when it's a resistant client like that, get to know them, get to know what's important to them, build a relationship. It's not going to happen overnight. There's not a magic wand, but often by doing that, you gain some trust, and by finding out what do they want, what's important to them, what are their goals, or maybe what are their fears and what's been preventing them from going to the doctor or in other kinds of obstacles as well. And that, maybe not batting 1,000 on that, but that more often than not, that works.
I love it. All right. I knew this question was going to come in. Suman asks, what is the approximate charges for an aging life care manager? And Suman, we have 3 different geographic areas represented, but does anybody want to give it a shot on just describing kind of how much it might cost for an aging life care manager?
I will say there's a range. I'm glad you brought up geography. So I want to say it probably starts anywhere from 100, 125 and goes up well over $200 an hour. And I think we all probably bill in increments. I know we bill in 6-minute increments. Some people do 10 minutes, some people do 15 minute. Some people charge mileage, some people charge travel time. So there's really a range. And I think the more urban areas, the higher the cost is going to be, maybe. Correct me if I'm wrong, Elyse and Catherine.
I think you're right.
Yeah, I think you're right. And yeah, there is a range, and there are some practices that charge flat fees for certain services, and although generally the model, as you said, Heidi, is more on an hourly basis. So yeah.
Great. Yeah, I mean, but what's important too is just call a few aging life care managers in your area and talk to them about what they're charging. Also, in some parts of the country, like here in Northern Virginia, there's a program called ElderLink, and it's associated with the county government. And there might be some more creative nonprofit government options in your region as well. Okay. Jose asks, is any of the life care management expertise being captured in AI? Do you think that AI could assist in this field? Great. Can't have a discussion these days at all without AI. What are your thoughts on AI in your profession?
I think that, AI, as you just alluded to, Steve, it's a very topical topic these days, and it's infiltrated so many professions. And I think, in some cases, it's really made the need for some human beings, if not obsolete, certainly lessened it. My personal opinion, and it's still pretty new, is that we're very high touch. That's part of the benefit of what we do for families. So I don't really see us being replaced by AI, and I haven't really seen, other than perhaps in some written materials that maybe at times I think are written by a bot, that I see sort of just in the field. But I'm not sure if that totally answers the question, but I haven't really seen the impact of AI yet for us. I don't know if Catherine or Heidi have any differing opinions.
I have so we CareFor also has home care. We have private duty caregivers that work for us. And I would say I agree with Elyse on the care management side. Care management as a whole is culturally very concierge, very high touch,
Mhm.
very customized. AI has entered into the home care space a little bit. And I see AI in this space as a supplement too. I mean, I think it can enhance in some areas. There's some interesting um, AI innovations in the home care space that have uh, that are working towards like better patient outcomes, fall predictive type technology, um, and some engagement, dementia support type AI things to combat isolation and loneliness. And I think they are resources and tools for care managers to implement as appropriate um, to help in the home more than a one for one replacement. It's more just there's a lot of technology out there. I think anytime, my team is mostly nurses. We typically deal with a high level of medical complexity. Anytime you get into personal medical information, there's HIPAA and confidentiality. And so anytime you're going to integrate a technology into that, I think you want to be really clear on the privacy and who has access to that information or who can hear. Um, but I see AI as more of an integrated support than sort of a one for one replacement in this space. That's my opinion.
Great, great. Okay, let's see. Okay. Uh, Gretchen says, what criteria do you utilize when recommending a long-term care facility to a client? Do you visit facilities and review Medicare inspections? Yeah, that I'm curious on how you work with clients. Yeah.
I get this question all the time. What's the best place to go? And it's as simple as that. And I try to dig down a little deeper. What do you mean by that? And do you mean where am I going to get the best care? So it's learning about the operations, senior communities, long-term care facilities, skilled nursing facilities. It's learning about the operations there. Because the bottom line is, I hate to say it, but we're a nation that has a shortage of caregivers. Now, that doesn't mean everybody's going to get poor care. I think you have to understand what the services are, where our expertise, we have clients in these places. I mean, that's going to come up all the time. I mean, our practice, we started with senior housing and learning about that and recommending places. So we visited them. And now it's just a question of we have several clients, many clients, I should say, in all types of communities. And yes, we look at Medicare.gov. I give some validity to it. I understand how those inspections work. When I did work in that arena, I learned about it in the state of Virginia, and every state's different. There are really great things online as far as inspections. However, you have to understand the verbiage used, what things really mean, because citations happen at all places and regulations vary from state to state. So I will say I think Virginia does a really good job, but it's not the be all end all. I would never choose a community or a care facility just based on an inspection.
Yeah, and I just to piggyback on that a little bit. I mean, Medicare really only gets involved at the skilled nursing level because they, in almost all cases, with very rare exception, Medicare is involved for rehab and so on. So there's federal money going in, so that's why the Medicare.gov, which we do use. I always say you got to take it with a grain of salt, though, for the reasons that Heidi mentioned. But I mean, I believe this is true nationwide. It certainly is true in New Jersey that the assisted living and memory care, they're not regulated, then Medicare is not involved with them. So they have certain regulations from on a state basis, but you don't have that kind of statewide survey and so on. And I always tell families, I guess, two things that come up a lot besides, of course, money and planning strategically, which is so important. for how to fund long-term care. But people often pick a place based on proximity. And although that is important, I'm not saying it's not, it's just a piece of the pie. So there might be a place that's an extra 10-minute drive that's a lot better for your loved one. So I try to kind of get people to think about it that way. And also, of course, not to just judge places by, the way they look. I mean, not that that's not important, it is, but the care, of course, is generally is of course more important. And the staff retention, usually places that have a revolving door. I'm painting with a broad brush here, but generally speaking, that's not a good sign. So that's another thing to look at.
I
All
think
right.
to
Okay.
just say one more thing, I think the value of the aging life care manager in this scenario is, beyond the marketing tour, beyond what they're going to say.
Mhm.
Aging life care managers typically know patients in these
Right.
communities, and there's a lot of administrative turnover in communities, and it can drastically impact care. And just knowing the inside look, I tell people all the time, I know the chandelier is beautiful. It will not pick your loved one up from the floor when they fall. And to Elisa's point about like we got to look past the wallpaper on both
Mhm.
sides, whether it's like gorgeous or like not your favorite.
Mhm.
Um, the care in these places and the survey only tells you so much. And so knowing residents in there and their experience and the way they welcome family participation in the care plan, their openness to receive feedback and change and do things differently, the relational side of it, I think, really matters when you're thinking about the best location for your loved one.
I love it. Thank you. Okay, Helen, this is a question that we've never had before, and I love it. Can you explain what types of things you do for clients and what you delegate out? For example, routine doctor's appointment or day-to-day help? Um, Great question, Helen, and I'm curious at the panel how you'd answer that.
I'll take a stab. So I will say that this answer is going to vary based on the practice to a degree. From my experience, the care managers in our organization will work, as Elise said, on the strategic level with planning and developing a plan, but then also sort of the boots on the ground execution, attending doctor's appointments, scheduling doctor's appointments, making recommendations, setting up medications, managing meds. My team is nurses, and we work with physicians to do that. I think different practices have different thoughts about that. Typically, the private duty care for those of us that have caregivers that work for us, we work with the caregivers within our team. For those that don't have caregivers that work for their organization, they have strong, strategic, longstanding relationships with home care companies and integrate them into caring for their clients. The hour over hour care is not what a care manager typically does. That's when you are bringing in another organization. You are outsourcing physical therapy, occupational therapy, speech therapy, skilled nursing. Um, you are typically finding an organization that can help with meal prep. You're working with an organization that can help with transportation beyond if you're just taking them to the doctor's appointment and returning home, helping them with community engagement. Whether that's you're providing support in the home to do that, or you're providing them with resources in the community. So the care manager typically visits weekly, biweekly, monthly, quarterly, sometimes if they're very stable. I've seen a lot of questions about sort of the solo ager planning. And then builds an ecosystem for that individual that will provide more the hour over hour interaction if needed, the daily support, the daily touch bases. We certainly have had clients that we've seen every day, but that's usually for a particular issue. Maybe we work in the psychiatric space for maybe some higher psychiatric needs, but not typically someone that we've seen daily for an extended period of time.
I
Yeah.
love it. All right. I also want to remind everybody this discussion is recorded. All the chat is recorded too. It'll be at Pro Aging later this afternoon. And so if you got to jump off, and we got lots of questions. So I know I haven't hit many in chat. Let me do this one in Q&A, and then I'll go hit some of the ones in chat. And here's this is from Robert, and he says he's 78 years old. He's a widow without children. He's healthy and he's active, and he plans to live in his home as long as possible. And I want to have a plan that simplifies decisions that my nephew would need to make. What would the plan look like, and what would the scope of putting together a plan be? And he's asking, how many hours? Now, Robert, I will say you want to talk to a handful of care managers, and I think they're going to be a great solution for you. But based on this description that Robert's given us, can you guys give him some ideas on how your practices might work with him?
If I can just start quickly, on our website, we have the different services, which all kind of overlap a little bit, but what Robert is describing is what we call aging life care planning. And I start out with, you've got three choices. You can age in place, which Robert wants to do, and most of us want to do. Probably about 10 to 15% of people will move to a senior community, and the other ones, very small percentage perhaps, will live with family. Well, Robert doesn't have family. So he's got two choices. We do a deep dive of each one of those choices. How are you going to make that work? So if you're going to age in place, you have to bring services in. You have to focus on safety and well-being in the home. What's your socialization going to be like? How are you going to receive care? Everybody says, I'm great, I don't need any help, but we all know that we probably will as time goes on. So it's preparing for that, and an aging life care plan or a roadmap of some kind, which I'm sure Catherine and Elyse do, can actually prepare you better and prepare your responsible party, your nephew, I think you said. So your nephew could hire a care manager, or you could hire a care manager, and we do something called future care to develop that relationship and prepare for those days so that you can age successfully wherever you live.
I love it. Catherine and Elise, how do your practices work with somebody like I forgot his name, Robert. Yeah.
I'll jump in. So we have a program that we actually just started in the past year that we call Plan Ahead. And I sometimes liken it to insurance. It's not insurance, but we do, as Heidi mentioned, a deep dive where I call like an intake, where we really we really find out everything medically, psychosocial, just who this person is, what their what their wishes are, and then if they're healthy, we see them annually. And then if and when things change, and that could be 5 years, 10 years, could be 6 months, then we're there. We already have all of their info loaded in our system, and we're there to step in. They're a client, and so on. But it is, again, there's a little bit of an insurance aspect to it, because just like any insurance, everyone has car insurance, and no one uses it until something happens, and inevitably, in the aging process, that something happens. There's some event of some kind. So that's how we handle it. And it's been well received, I must say.
We're very similar. We also serve as medical power of attorney for individuals, but folks that already have someone named, but maybe they're out of state, they'll list CareFor as their emergency contact. And we have a nurse on call 24/7. So that can be helpful for people that are planning. We're planning for the future. And also we have something available and a safety net in place for a crisis. Where I see my CareFor engaging the most with those solar agers or folks that have engaged CareFor for a future need is usually like when a surgery comes up. They don't have an incapacitation or a long-term diagnosis, but they're having their hip replaced, or they're having neck surgery, or even some sort of colonoscopy endoscopy combination, and they're going to be somewhat sedated and need transportation. But also just want someone to know that they're going through this. On the surgical side, we'll attend and we'll provide care afterwards and provide some home visits. And so I think all of the aging life care managers across the nation have some form of a planning plan. And I think what I would just challenge you to think about is not just for the future sort of aging and incapacity, but also there's just life things that come up where you're going to need to have a surgery or an illness or an injury, and you need someone to call. And it's so much more efficient and from that peace of mind standpoint if they already know who you are. We certainly all function in crisis. That's sort of how we all came to be. And we can jump in and help. But if we already have your information, it's so much easier for you and so much easier for us to just get the ball rolling.
I love it. All right. MJ's got a question that I've never heard specifically, but she says, or MJ says, where do you get good training about helping a family sort out the financial aspects of deciding on long-term care, aging at home, hiring caregivers, understanding how long-term care insurance pays? Um, and MJ, I know you're asking about getting training, but maybe we can reframe this because I know this is something that aging life care managers provide guidance to a lot of families on, all the things that you're talking about. But any words of wisdom for somebody like MJ besides, hiring an aging life care manager to help with these complex decisions?
We actually have a matrix that I can send you, Steve, but it talks about the levels of care and what they cost and how to know it's working and how to know it's not working and when you would need to think a bit more. But I think it's really just around education of understanding what are all these terms, what do they mean, and what is the dollar amount in my market? And what we have is listed specifically to our market. So that's not so much the part that's translatable, but it is the context around what should I be asking. There are a lot of really great financial planners that we work closely with that help with this, and realtors and elder law attorneys that have a lot in this space. When you talk about entering AI, this might be controversial, but this is like from a market analysis stuff, something. This is something I would like enter into like Chat GPT and say, for my market, what is the average cost of a private duty caregiver? For my market, what is the average cost for an assisted living, a skilled nursing facility, a memory care? And you're going to see raw data. Now, all of that needs to always be sort of filtered. But it's a function of understanding, like educating, having an education and understanding of what are the terms of these various communities, levels of care, and needs in the aging space. And then for my market, what are the dollar amounts attached to those? I went and found her question and I'm looking at it and I think that answers it, but if not,
Yeah, no, I actually, what I liked about what you said, Catherine, is you referenced realtors, financial planners, elder law attorneys, and I would say that, one of the key things on here that I want to pull out is long-term care insurance policies. Do the three of your practices help families review these and understand what their policy is going to pay for?
Yeah, I mean, we do, and I would say 10 years ago we didn't see them, that often. I mean, now it's 50% of the time people have a long-term policy. It seems to me that's just a sort of a gut percentage, but obviously understand the policies. Some of them have care management benefits. They sometimes are called care coordination or some other term, but we always ask them we'll review it and see if they allow us to actually look at the policy, which most people are fine with, to really help them to understand it. As far as the sort of the question though, I mean, for me, I'm a big stay in your lane person. So I think the value that aging life care managers bring with all of those host of things that came up in that question, or understanding the intersection of those things, someone's care needs and how best to serve those care needs with their financial profile. That's something elder law attorneys don't really understand. That's something financial people don't understand, and long-term people who sell long-term care insurance don't understand. So I think that's the value that we bring. But for me, I like to work with other professionals where that's their area of expertise, let them sort of weigh in on those aspects, but sort of use our knowledge and experience to help the family
Yeah.
figure out what's the best solution.
And again, the role that you all play of quarterback, wingman, wedding planner, contractor is great for questions like this one that came up, is
Mhm.
being able to sort through this and explain it to the clients. Um, Joe has a question. When you're helping your clients find care communities, do you evaluate the smaller residential 5 to 8 residential communities?
Yeah, I think that varies across the nation, but absolutely. And in Virginia, Northern Virginia, a lot of people don't know about them, and they're a perfect fit for a certain type of resident or client there. And I think you have to look at all senior communities as what's the best fit for my loved one. So absolutely, in Virginia, they're licensed just like any other assisted living. So it makes it very easy to research them and know how they operate.
Several questions related to a recent article that came out in the Wall Street Journal about a life plan communities going bankrupt, and some of the or somebody made a comment, it's not just about life care communities going bankrupt. A company came in and bought my mom's community, and we lost a portion of the entry fee. I'll cut and paste this article in chat. We did a summary of it, but curious. I think the audience is curious on your thoughts when management changes, when there's these confusing contracts, or not confusing, there's these contracts. Any guidance? I'd be curious at any of your thoughts on this.
I'll just say, and I read your summary. Thank you for posting that because I don't subscribe to the Wall Street Journal. So that was really good. And I'm very interested in senior living options and continuing care retirement communities. So it piqued my interest. Here was my initial thought. Let the buyer beware, recognize that it's still rare. Um, be involved for your loved one that's there. I mean, they all have opportunities for family to understand the operations of the place. I mean, there's no guarantees. It's a scary thought to lose money. It's also quite common for these investors of the for-profit communities, the smaller ones. I'm not talking about the big nonprofit retirement communities. It's also very common for those investors to change. So there's always the ownership and the management company, and they're usually separate from my knowledge in this area. And I think getting to know them and understanding what the implications are of a transition. Usually the staff stays relatively the same through a transition, but it can change and it can be very disruptive. So you kind of have to really understand how people operate and what's good care versus, that's probably not a good practice that they're doing or something like that.
Yeah, and again, just having an advocate when you're in any of these communities gives you the ability not to just sort of listen to what management is telling you and thinking that this is what I've got to do. Your breadth of experience enables you to advocate when somebody's in a hospital or when they're in an assisted living, and know that there might be more choices than the doctor or the management is letting you know.
Oh, absolutely. I mean, they're often, in their silos and they don't really know what's going on, out in the community. And one thing I did want to also that hasn't come up yet is that I just wanted to mention about aging life care managers is that we're independent, so we're not part of any, as a segue from this discussion, we're not part of any communities or any healthcare systems. We live outside of them, and the independence that we bring in is and that perspective is I think very valuable, and certainly we get that feedback from families. And also did want to mention that as part of our standards of practice, and this is in writing, we're not allowed to accept any fees or anything, so we don't, and that does differ from a lot of other people out there that have a different kind of model. So we don't operate that way at all.
Holy cow, I just glanced at the clock and we burned through an hour already. And the Uh, First off, I want to thank you all. I want to thank our audience for these wonderful questions once again. Um, let's try to wrap this up. Is there anything that any of you didn't get to say today that you might want to share with the audience or people that are listening to the recording? Yeah, Heidi.
I just want to say the three questions, and if you're a family member, these might be nice to write down. When I meet with families, and this week I just met with a solo ager sister and her brother and sister-in-law, and she had declining memory. Um, but it was really important for us to hear the answers to three basic questions. What matters most? What concerns you the most? And sometimes people say, what do you mean? Well, housing and care as you age. And what's your plan? Those three questions are really key in our practice to get to know a client.
Great. I love it. Definitely a great conversation starter. And because they can be interpreted differently by each of us, those three questions. Catherine, Elyse, any final thoughts that you might have?
I guess I'll just say it's to really and this piggybacks on something that Heidi just said too. Just try to really have a plan. Your plan may be different than your next door neighbor's plan or your sister-in-law's plan, but think about it and really what do you want out of as the next several decades or whatever as it may be. And so often, and this did come up, that people call us when they're in a crisis, and we do step in and we're able to help, but it's really better to have those plans in place.
I love it. All right. Well, Catherine, you gotta finish it off here with
Yeah,
some inspirational words here.
yeah,
Yeah, I would just say you're not alone.
yeah.
Whether you're planning for a loved one or you find yourself planning for yourself, I know it can feel overwhelming. I know it can feel daunting. Um, but I want you to know there's a whole network of professionals across the nation that even if we're not the right fit for you, we feel a deep commitment to help find you the right fit, whether we make a referral or make you aware of resources in your area. Everyone's story is unique, but I do want you to know that fortunately, there's a lot of resources to help navigate this season, and you're not alone.
Yeah, this is great. And when we talk about planning, folks, a lot of times people feel like because we do business plans and things like that, that it has to be this term paper and it's in writing and all that. But one thing to think about, just signing up for this discussion today you've actually started planning. The people we're concerned about are the people that don't tune into a discussion like this, that are sort of putting their heads in the sand. They're not having conversations. They're not thinking and talking about this even to themselves. And so just being here is a step in the right direction. So man, this has been great, y'all. Thanks so much. I will get this recording up lickety split, and feel free to reach out. All our contact info will be on the recording link at proaging.com. Again, I want to thank you all. And Elyse, you get a much deserved break now since you just got off the plane. Go enjoy
Read
the
my
rest of your day.
emails.
Yeah, exactly. All right, y'all.
Thank you.
Have a great one, and we'll see you at the
Bye.
next one.